So, as we are coming into the room, I wanted to say welcome. I wanted to let you all know who I am and also learn about you all, so at least a little bit. So, you'll see in the chat some questions, just, where are you joining us from, just to get a sense of who's in the room today. But as far as introducing myself, my name is Dr. Jessica Tinstman Jones. I am an assistant professor with Nova Southeastern University in the counselor education or the clinical mental health counseling department in the College of Psychology. It's a great team, love being a part of it. I joined the team in about 2022, but I've been in the field for longer. So I'm an educator and I am also a mental health counselor. I've done a lot of work on helping folks to process trauma, working in direct crisis situations, so more crisis intervention, suicide prevention type things. That's included inpatient work with folks that have really severe symptoms or challenges, and also outpatient work. So I've gotten to connect in a lot of different ways with a lot of different people. I do have a personal connection and desire to support the military community. So that is one of the populations that I've worked with pretty significantly as a counselor, and that I continue to do research and other types of engagement with. So that's why it's near and dear to me in that sense. I'm also a military family member, so I want to be clear because I think it's important to be clear that I am not a military member or veteran myself, but I have significant portions of my family who are across multiple branches: Air Force, Navy, Marines. In particular, I think I have a couple of cousins in the Army right now as well. So I've got lots of connections in those ways, and that's kind of where my passion started, was recognizing how military mental health affected not just the military members and veterans, but also the families, and wanting to do what I could to be an advocate and a support for this population, helping those that are in need and helping others who are trying to help those that might be in need. And you'll notice in the chat too, we want to know what your military connection is, if any. Are you someone that's just interested? Are you a military member or veteran yourself? So that way we can get a sense of, again, who's in the room and what's bringing this topic to importance for you. So then as we kind of check in with that and see what's going on there, I'm seeing lots of folks that are working with veterans and also veteran family members or military members. So I really appreciate you all for what you do for the military community and also for you and your loved ones' services. So thank you. And I appreciate your time being here today. So from here, I'm going to keep an eye on who's coming into the room because I want to know those things. And I'm also going to go ahead and start moving into the content that I have. That way, we don't spend too long in any given space and we have time for questions at the end if things are coming up for anyone. So just to kind of give you a sense of the agenda that I have, first thing I'm going to do is kind of talk broadly about military culture and experiences. I do want to be clear right off the bat that it is really difficult to touch on all military culture and all military experiences because depending on your branch, depending on your rank, depending on your location, depending on so many factors, it's going to look different. So what I'm sharing is kind of a general overview in that sense. So I just want to be clear about that because I don't want anyone to think that this is an exhaustive list of all the things that someone might navigate, because we would need a lot more than the time we have today to be able to do that. So I just wanted to make sure that I'm highlighting that as we move forward into the next piece. And then we'll also talk about the impacts on mental health that can come from military affiliation, some of the specific challenges that are faced. In particular, I did put it on there because I wanted to kind of give a disclaimer. Many of you likely know this as you're approaching this topic, but one of the more prevalent impacts on terms of mental health that we see is an increased risk of suicidality that can come from military members, veterans, and even their families. So I am going to talk about that, and I know that can be a sensitive topic for some folks in the room and just folks in general. So I wanted to make sure I was mentioning that so that you had a chance to know that's coming. If anything in this presentation is kind of activating for you or bringing anything up for you, please do something good for yourself today. Take care of yourself. Do whatever you need to for self-care. I want to make sure that you all are okay as well. Beyond that, then we'll move towards what we can do about these things. So I have some strategies, some tips, some suggestions for how we can foster wellness and improve mental health outcomes for military affiliated individuals. So that's what I'll be doing here today. So hopefully that's what you're looking for as you're joining me, and we'll go from here. Right. So, like I said, I'm going to kind of speak broadly to some different cultural elements. One of the first things that I like to highlight is that the military culture is its own culture. And many folks know that if you're in this room and you have a lot of the connections that I'm seeing here, where you again have family members that have served or are actively serving, or you yourself have, or you work with this population. Right. So again, kind of leaning into the cultural elements, I just like to emphasize that this is its own culture. In many of the classes and things that we do to train clinicians, we talk about so many different cultures, so many folks of so many different backgrounds. And I just like to emphasize that that is its own distinct experience being a part of the military and has its own kind of way of being and way of viewing things as well. So I like to kind of introduce it as military culture and emphasize that cultural component so that we can take a moment to understand what that means in terms of some of the shared factors and experiences that come up through affiliation to the military. So, something to mention kind of right off the bat that is relatively universal across the experience is that it is very structured and very hierarchical when you're involved in the military, meaning that there are a lot of rules, there are a lot of regulations, there are a lot of expectations to be following that can be very rigid in terms of how you dress, how you talk, how you engage with others, the behaviors that are and are not appropriate when you're on base or in any given location. So it's important to recognize that component of what this looks like so that folks can think about, okay, how might that affect a person beyond just the service? Because naturally that's an important component that there's a clear chain of command. I know who to refer to, who to get instructions from, who to report to, and I have enough structure in place that we can have what we need for missions to go well, for training to go well. So they're important components and they influence how we interact with one another beyond that as well. Thinking about somebody who's very involved in that and integrated into that type of experience and then coming home to their families, there's carryover. Even again, just in terms of how someone might communicate, expectations someone might have, a desire for others and for themselves to have clear expectations and clear standards and guidelines for what should be being done at any given moment. In terms of that communication, again, that can also be very strict. A lot of kind of clear conventions in communication, a lot of the traditional yes, sir, no, ma'am, those types of engagements. And that can be expected from those around us. And it can be confusing if it's not the same experience for everyone. But you may see that in terms of your interactions with military individuals and how they're engaging with you or how they might be engaging in their care or anything else. Branch affiliation also does make a difference in terms of kind of camaraderie or competition between branches. Some branches have more positive or negative views of each other, have different ways of referring to one another. So even terminology in terms of, again, referring to one another, referring to different elements of a mission or training, that can be different as well. So it might be something where you think you know a lot about it, and then you recognize, okay, I know a lot about the Army, but I didn't really know a lot about Coast Guard. So it's helpful to kind of consider that whoever you're working with or whoever you know that you're trying to support, what is their experience? What is their language? What is their way of engaging? So we can know about that. We also want to consider ranking. If you are somebody who is an enlisted member, someone starting out versus someone who is a captain, someone who is higher up in terms of that, someone who's an officer. So you want to think about that because that's also going to influence the experience that an individual has in terms of what types of engagement they've had, what types of responsibilities they've held, and how that can then also influence how they interpret and process the experiences that they've had. There are also very strict values when it comes to military culture, things like strength, bravery, independence, um, being able to focus on the mission first ideal. These are things that help these individuals to focus, to engage, to have the strength they need to get through whatever they need to get through. And especially that mission first ideal, that idea that I'm going to put this above all else in my life, above myself, above family, above other things. because it's necessary for survival. It's necessary for successful completion of what's happening. And not only my survival, but the survival of my unit, the people around me that are also a part of this. So it's an essential teaching and way of life. And again, it can have impacts in terms of mental health, where we can see that that focus can influence how I then am able to think about myself, or if I think about myself, or others in my life, again, or other responsibilities, where it's hard to reprioritize or kind of shuffle that perspective because it has been all about this. And even from a family member perspective, it's important to know and embrace that message because, again, you're looking for the survival and hopefully healthy and successful outcomes of the missions for your family member or for your loved one. So that's something that can be difficult to navigate and can have its own impacts on support systems and how we connect with one another in cohesion, but also is essential in those moments. So I like to highlight the essential components of those values because sometimes it can seem like, oh, well, why would you want to do that? Or it's important to balance or whatever it might be. And yes, those things are true, but there's a reason for why things are the way they are. So I think that's important to acknowledge. Even in terms of strict rules and guidelines, I know I kind of mentioned it, but even things about, what time you're presenting, how you're dressed, what your appearance is, how you maintain your home if you live on a base, how your family engages and the behaviors that they demonstrate, again, primarily if you're on base, but in a lot of different settings as well. So there's kind of a consistent need to be on and to be adhering to rules and expectations. And that can be a lot for folks as they're navigating through the different experiences of being a military member, transitioning out eventually back towards civilian life or non military life, and going through these different types of experiences. I've referred to experiences a few times. So I also want to highlight kind of what I'm referring to when I'm talking about that. This is very broad in that there are many different things that somebody who is in the military may engage in. One of the top things that might come to mind is war, combat, but there's also other things like peacekeeping, restoration of safety or restoration of services in areas that have been affected by a natural disaster or by other types of crises. The training in and of itself is essentially the same thing because the idea behind the training is that you're training just as hard or harder than you're ultimately playing. And obviously, playing in this sense, I don't mean actually, I mean with the service you're going to engage in. The idea is that you've navigated the potential barriers, the potential hardships, the potential physical impacts, emotional and mental impacts that you might face in any given mission that you're navigating. So that training can be just as intense psychologically and physically as actually engaging in whatever assignment that you might have. Naturally, those types of deployments, when folks are going out to different areas, when they are engaging in combat, when they are engaging in whatever their mission is, also requires kind of a full cycle. So when it comes to deployment, folks get their orders, which may have, some time to build up or training that's required, or maybe immediate, we're needing to do this right now. So how much lead in there is varies drastically, which also influences how folks transition away from family or away from other responsibilities and kind of shift their mindset and approach. The actual deployment itself, when they're navigating the mission itself, and then coming home, which at first can be really exciting. We see all those wonderful news videos of reunion and folks coming back together and those beautiful moments. And those are fantastic. And sometimes that sustains, but also there's a big transition post deployment of trying to reintegrate into other roles, other responsibilities, other systems that we've been disconnected from. So I just kind of wanted to emphasize the kind of cyclical nature of deployment, that there are different phases to that, and that each of those has its own challenges, their own things to navigate. That is an area where we tend to see the most challenge, not in deployment necessarily itself, but in those transition stages. And that's something to consider in terms of the mental health you see of those around you, or for yourself, or for those that you work with. In those different separations, that's another key component. So as you're leaving, as you're coming back, you're having separation, you're having reunification, you may be relocating to very different geographical regions. You may be in international locations where you don't even know the language. So these are all factors that can influence how somebody navigates through these experiences and ultimately what types of outcomes they may have. There's not any one thing that I can say, this is the number one challenge in terms of what type of a deployment it is or something like that. But certainly a big factor is exposure to combat, is exposure to violence, things like seeing the aftermath of tragedies, having to directly engage in warfare, in combat, in use of firearms, potentially injuring or ending the life of someone else, or seeing that happen to others around you, being physically injured yourself or psychologically wounded through those experiences. That does play a big impact. It doesn't mean that everyone that navigates that has negative outcomes, but it can increase the risk factor because it kind of gives increased exposure to different types of trauma that can naturally lead to different types of symptoms as a result of that trauma experience. So, when I'm saying trauma, I'm talking about sudden, unexpected things, even if it is expected sometimes, just the severity of what you're exposed to. It can be loss, it can be personal injury. It's really anything that jeopardizes our sense of safety and security. So there are a lot of different things that kind of fit into that umbrella. Like I said, in this particular population, a lot of that can come from combat, exposure to different populations and challenges and things that have been going on that now we're responsible for trying to step in and help. And maybe don't know that we have the tools that we need, or even if we have the tools, it's difficult to be able to get to that place of witnessing, engaging, doing it. In the moment, that can be difficult. And then in the long term, once somebody has come back home, transitioned back, those types of things, then when that processing starts to happen, it can be difficult again. So there's kind of a continued process that goes with any type of exposure in these areas. So, thinking about impacts of service, one of the things that I also think is really important to do when I talk about military mental health is to emphasize first and foremost that yes, I'm primarily talking about some negative effects that can come and challenges that happen, but not everyone who is involved in the military has a negative outcome. So I really want to highlight that there are a lot of positives to be gained from military service in terms of the different types of experiences someone gets to have. I mentioned exposure to challenging conditions, but that can also broaden someone's worldview. Maybe you get to see areas and learn about cultures and people that you never would have had an opportunity to otherwise for financial reasons or other types of limitations, or just not even knowing that you wanted that exposure or needed that experience. So there are so many benefits in that sense with travel and enhancing our worldview, enhancing our understanding of others, and the development of resilience. Even if you're going through significant stressors, continually going through them and coming out on the other side does build our ability to come back, to come out stronger from situations, to learn, to grow, to thrive, even in those adverse situations. So resilience is a really key thing that we see and that we try to in on and to support the development of for military members, veterans, and their families because they have had so many experiences where they've been able to develop that capacity. In a lot of cases, military members and their families report that overall they have enhanced well being from their service. Again, it can be from that deeper understanding of others, that development of resilience, learning how to come together as a family or in other social systems, a partnership, friendships, whatever it is. Learning to navigate these things together can promote increased connection, deeper understanding, empathy, engagement. So there are so many positive things that can come from it. A lot of people will say that military service is the best thing they've done or one of the things they're most proud of in their lives. Not everyone, but a lot of people do have that perspective. And that's something that's really important. Because again, the idea isn't that I'm coming here to say there's negatives for everyone or that we need to emphasize those. And in fact, in helping folks that are having a more difficult time, being able to point to strengths, being able to help someone start to focus on resilience, focus on growth and things that they've achieved, that's something that can be helpful in the long run. And a lot of the time we see that folks get there on their own. They can also develop really significant skills. It can be tech based skills, leadership, all sorts of things that maybe you wouldn't have had a chance to learn before. Sometimes there's educational components. Folks can have college paid for, can have the opportunity to engage in more education and have more training that can help them in their career development or pursuing other passions in their lives. And those are resources that others may not have access to as well. So having that opportunity does give the chance for being able to take those things forward in a way that feels productive and feels meaningful. And that can be applied to families as well. So there is education and other resources, different healthcare options that can be given to not only military members and veterans, but to their family systems that can be of great benefit to them. So that's another thing that can be a benefit from service, kind of on a resource level. I mentioned before, we often see that when negative symptoms do arise, they often are related to the deployment cycle. And then we often see that for most people, they rebound back and either come out feeling stronger or come out at least feeling consistent with where they started. And then for others, there are more negative outcomes that I'm going to kind of lean into from here. So, thinking about why deployment is so difficult involves, again, the experience, whatever you're directly exposed to, and also the transition components. For instance, if you're really connected with your family, your friends, folks, sorry, that are a part of your life, then it's really difficult to separate from them naturally. That's relatively straightforward. But folks in the military are also really connected to their unit, to other members of, the groups that they're in there, the other people in their military community. So there's kind of a separation from some groups, a re-engagement with others, separation again, and it's all very back and forth in that sense. And that can be a lot for someone to process and keep up with. And it can cause strains on those support systems and how they're able to get the support that they need and that they're looking for. So, those strained support systems can be a big risk factor when it comes to other negative outcomes, along with just the difficulty of processing and disconnecting and reconnecting with responsibilities and roles and other things that are coming up. Post traumatic stress is also very common, especially again, I mentioned, how broad trauma can be. Whenever folks have had those types of exposures, it's not uncommon for them to then have stress reactions as a result of those. There are many different symptoms that can be associated with post traumatic stress or a more formal diagnosis of post traumatic stress disorder. But for instance, things somebody might see are shifts in how somebody engages in their life, shifts in how someone's emotional responses look, nightmares, sometimes auditory or visual hallucinations or flashbacks, paranoia, fear, a lack of safety, difficulty trusting others. Those are just a few. Like I said, there are many, but those are some things that might kind of show up when we're considering what post traumatic stress means and what we might see from someone who's navigating that type of situation. Something else that's common is misuse or abuse of different substances, whether it's alcohol or something else, opioids maybe that they were prescribed for an injury and now they're continuing to take or use incorrectly. There are a lot of reasons that that can happen. With injuries, it may just be that someone develops a dependency as they're trying to care for themselves. In other situations, it can be that someone is looking to manage the physical or psychological pain that they're navigating in the aftermath of something that they've experienced. So it can be really common for military members to have those types of coping mechanisms that aren't always the healthiest, or maybe start out in a way that was just having a drink every now and then, but escalate over time. Even behavioral addictions, things like gambling, can become prominent as a form of escapism or a form of self medication that can then escalate as things progress and as people start to view that as maybe the only helpful outlet that they can identify. So, jumping the gun on tips a little bit, finding other types of ways to cope, other types of resources can be really essential in terms of healing. So, this is also important to note, and I noticed a comment about this, so I want to highlight that. The issues that I'm talking about also are not exclusive to deployment. So I know I've emphasized that and I've emphasized the transition, but it can be related to a lot of different factors. And they are common issues whether someone is actively deployed or has experienced one or multiple deployments, or even if they haven't. So, again, it can be ways of coping with separation, with stress, with all sorts of things, or ways that somebody was engaging in free time while they were gone that's turned into a larger habit. So, there are a lot of reasons why that could persist in different ways. When it comes to suicidality, I am going to highlight this over the course of the next couple of slides as well, because I think that that is a particular area that we want to focus on. Again, I know it can be a sensitive area, but it is one that I want to make sure I'm giving appropriate attention to. Other things that can be difficult in terms of navigating experiences, though, I mentioned separation and difficulty adjusting, reacclimating, finding your footing again with your social groups or your family. That is challenging, and there can be different expectations put on you as well in terms of carrying on in the same way you've always been, even though maybe different experiences you've had have influenced or changed who you are in different ways. So, those expectations, difficulty sharing your experiences, again, whether it's multiple deployments or training or any part of it, it can be difficult to communicate what you've navigated or how it's affected you with someone that maybe doesn't understand it the same way. So there's a lot of different reasons why it can be difficult to then come back and openly communicate and all those things that we would love to see happen, but just sometimes don't fit with the situation or don't fit with that person. I do also want to briefly mention families because, again, it's an area that's important to me. And I think it's important to recognize in a broad sense because, in many ways, military families are serving in very much the same ways as military members and veterans. They may not be actively training or actively deployed, but they are navigating these cycles and transitions and trying to offer support, trying to understand, trying to engage in so many ways. And sometimes, again, I mentioned when I talked about positives, the military families often have positive traits from that as, collective resilience, deeper connections and bonds with one another, a different value and appreciation for different things and the relationships in their lives. At the same time, there can be exposure to vicarious trauma as they hear about some of the things that their military loved one has experienced. So that's something to be mindful of is that that's going to have an impact on you as well. If you're someone who's a friend, a family member, a loved one, hearing those things can be really difficult. So that can lead to the possibility of our own mental health challenges in terms of maybe increased anxiety or depression or fear around situations. You weren't directly in them, but knowing about them can sometimes have that same impact. So those types of things are common. There's also a potential for an increased risk of intimate partner or familial violence that can often be associated with more severe psychological symptoms, that sometimes it's very unintentional. Somebody in a state of hallucination or something like that could become verbally or physically aggressive, but it could also be in terms of how someone communicates, the types of ways they've learned to interact or haven't been able to build that same emotional connection. In general, substance use and those things can also be an increased risk factor. So, by no means am I saying that that is always going to happen in family systems or partner systems or anything like that, but there is an increased risk. So, I just wanted to mention that as well. In terms of family cohesion, I mentioned that it can be stronger in the sense that as folks are coming together and have that value, have that experience in a different way, it can become a strength. But the separations can also lead to disconnects, where a family system learns to operate without their military family member, and then it's hard to figure out where they fit back into the picture when they are back. So there are a lot of different reasons why that can be a challenge. In terms of safety risks, broadly speaking, military members, veterans tend to have increased training and access to firearms and other things that could be lethal methods when we consider suicide risk and things like that. Often that might mean that those things are also in the home or that other members of the family also have different types of training or exposure, which is certainly a risk factor if other symptoms are present as well. Financial difficulties that can come up in transitioning obviously put a strain on the family system in all sorts of ways. I mentioned the mission first ideal, so I won't reiterate that piece, but also just the communication challenges and the misunderstandings that can come up. All of that can increase the likelihood of negative outcomes in some capacity, not always in terms of suicide risk, but in terms of just navigating different family stressors and strains and having to figure out ways to rebuild and reconnect. So I mentioned I was going to talk a little bit more specifically about suicidality, so I want to make sure I'm doing that. In general, there are a lot of different risk factors that can contribute to this increased risk. That said, not everyone has this experience. Not everyone will have these outcomes. If you're a provider, it is important to screen for them, maybe a little bit more closely. We should be screening with everyone, but also whenever we know that risk factors are present, we know that we should be on extra alert. We know that we should be more mindful of the things that are being said, of changes, of things that could happen that could indicate this type of risk. So we're going to pay close attention. But for military members, for veterans, for those that are navigating this, there can be a lot of isolation. My family's moved on without me. I'm separated from my unit that I feel close to and that I can connect with. I'm going through this experience and I feel alone. I don't know how to process it or who to talk to about it. There's a lot of reasons why someone might feel isolated, may feel like they don't have support systems or connections that can help them get through something. So that can be a kind of common thread in this. Another is difficulty talking about the experience. So even if you have others physically around you, you may not feel safe to share. You may worry about traumatizing someone else, so you don't want to share too much. You may worry about how somebody might perceive your experiences or your actions, feeling like it's more of a risk to be open and possibly lose others in your life or damage the mental health or well being of others in your life. So then it feels like, okay, I can just be strong, I can hold it in. But that doesn't always mean that you're having healthy outlets or healthy coping opportunities if you're keeping that all to yourself. So that can be a big risk. Stress from deployments, I've already mentioned. Challenges with transition, I've mentioned as well. Different mental health concerns can lend to an increased risk as well. We know, for instance, that with PTSD, with the different types of disconnection from reality that can happen sometimes, with increased sadness, with increased um, flashbacks, experiences of kind of reliving events that have already been difficult enough, the strain that that can again put on support systems as a result, all of those can increase risk. Even when you think about other types of mental health diagnoses like depression, like anxiety, the severity of those symptoms and some of the different experiences someone has can also lend to an increased risk. So there are a lot of things that we can pay attention to, and I'll mention a few more in a minute, that can help us to hopefully see a need and connect folks with help if we can. We may not always have that power, but being able to see it does mean that there's a better chance that we could maybe help do something about it. I mentioned trauma, I mentioned support systems and substance use, and I also just mentioned access to firearms and lethal weapons. So these are things that I'm just highlighting as some of the risk factors that can contribute to possible suicidal outcomes. In terms of the numbers, though, because sometimes I know that the numbers are helpful in kind of illuminating what this problem looks like, we know that military suicides have been 4 times higher than war operation deaths since 9/11. There are probably newer numbers as well. I got these recently, but numbers are always changing, so I wanted to kind of emphasize that. Military suicide deaths also increased drastically by 25% at the end of 2020. And as we kind of went into the pandemic and different administration changes that have been happening, there are a lot of challenges that have kind of increased that risk or increased stressors to the military community. In terms of family members, I've also mentioned there is an increased risk for suicidal outcomes for family members as well. I actually did my dissertation on this risk particular to children raised in military family systems. And there is a lot of evidence out there to support an increase in risk factors and unfortunately an increase in suicidal ideation, planning, and those types of behaviors as well compared to civilian or non-military communities. Numbers are always, difficult because estimates can be conservative. We don't know everyone who has or hasn't experienced that. Not everybody reports it. Even deaths by suicide aren't always reported as such. So it's difficult to make sense of the numbers, but what we typically can say is that even when the numbers are big and scary, unfortunately, there's usually more to that picture that we're not seeing as well. So, generally, this is something that is difficult to approach. And with family members being put in a position of needing to provide care or understanding when they're already potentially having increased risk factors themselves, it makes for a difficult situation because now you have multiple people that may need different support in different ways, not that are all experiencing this particular concern, but that may have other concerns and that aren't maybe qualified to be navigating these types of topics as well. So it's really difficult for folks in these positions because they feel like, okay, I have to protect my loved one and I don't know how to do that and I'm struggling myself. So I wanted to, again, just kind of reiterate that military mental health is military members, it's veterans, but it's also the folks that love them and support them and go through these experiences with them that can sometimes experience similar types of things. Veteran reports are also very significant and very startling when it comes to suicidality. It is the second leading cause of death for post 9/11 veterans, responsible for 22.3% of all deaths for post 9/11 veterans, which is really sobering to consider that it is that significant and that it's a risk that continues to be ongoing. A fortunate thing to note, or maybe a positive thing to note, is that awareness has increased significantly. And with more awareness, that means more support. It means more groups, more providers, more individuals who are aware of this, that are screening for this, that are trying to make a difference in this. So that's something that is an optimistic point in an otherwise pretty bleak picture to think about how significant of a risk this can be. Again, I want to highlight this is not all military members, all veterans, all family members by any means, but it is a significant proportion. Something that we're seeing is that the risk is 50% higher for suicide for veterans compared to civilians. And estimates say that by 2030, veteran suicides will be 23 times higher than those post 9/11 combat deaths. We also can see other numbers here. I don't want to necessarily harp on them for too long. They kind of paint a similar picture, but I did want to highlight that there are some other factors as well. So, for instance, that last statistic I have on the screen for you, that more than 70% of veteran suicides have occurred outside of VA care. I wanted to highlight that because a lot of the time, what we're seeing is that when those deaths are happening, somebody hasn't had support. So it's not to say it's always true. Sometimes they do have wonderful support systems, and unfortunately, outcomes still happen. But a lot of the time, folks, for whatever reason, haven't been connected to maybe resources that could help them, whether it's a lack of knowledge of resources or a lack of engagement, stigma that causes someone not to connect, wait lists that make it difficult to get care in the way that fits for your financial constraints and also with what you're able to engage in. There are a lot of factors that can contribute to that. So I'm not going to say there's any one reason for it, but that does say that in the vast majority of cases, folks might not be getting the support that they need. Now, I do also want to mention that they could be getting support somewhere else. So that's very specific to VA care, but still important to consider that if we're experiencing challenges with a loved one, a family member, with ourselves, if we're military affiliated, we might not be getting care and resources. And maybe we can either explore them for ourselves or help others to connect with them. Because you may not be a provider or able to provide those resources or assessments or tools or whatever it is yourself, but maybe the way that you can help is through helping to reduce the stigma or helping to get somebody connected. Now, easier said than done in a lot of folks and in a lot of situations. So I don't want to say that that's easy, but I want to say that that's something that is a way to be as proactive as possible in these situations. Some other contributing factors, I was talking about transition a lot, so I just wanted to give some stats for these things as well. It's from self report. We see that more than 40% of veterans report having high difficulty navigating transitions and are 5 times more likely in that specific time period to experience suicidal thoughts. More than 80% of post 9/11 veterans also report that people don't understand their situations or aren't aware of how to interact with them or that they don't connect. There are other stressors that go with that, where roughly 35% say they can't pay their bills within just a few years of separation from service. We know that, again, combat experience can increase that, but only about half of folks transitioning out of military service report that they feel prepared for that. And again, something that's important to note is that because of the increased awareness, there are more intentional efforts being made to give resources, to facilitate that transition in as healthy of a way as possible so that folks are prepared, do have plans. But we also know that that doesn't always meet the demand that's needed. So, increased efforts, important to highlight that, and important to continue to follow through with whatever help we can offer in our roles and capacities. There are obviously available resources when it comes to family and support systems and programs. I do have a slide at the end where I kind of give a big list of a lot of different things, so I'll share that with you all. But are also those challenges when it comes to economic or legal or relationship issues that can increase the risk of different types of negative outcomes. Another factor that I like to talk about is era of enlistment. And by that, I mean when somebody has served, what duration of time, because how somebody navigates their experience can also be influenced by the societal messages that are being received. For instance, if you think about history, you think about present time, you think about all sorts of things, there are times when it has been very revered to have military service, where there's been high patriotism, where folks are very vocal about support for military members and veterans and for whatever they're engaging in. And then there have been times when that's not been true, where there's been disagreement with whatever conflict may be active. There's been disagreement with how military members and veterans engage in their missions or what they're expected to do, or just broadly what we think of those institutions in general. That's important to note because if I'm transitioning back from service and I'm being met with positivity, thank you for your service. I'm being met with generally favorable views on what I've been doing, that can influence my mindset, that might influence my outcomes compared to someone else that comes back and is met with a more hateful or negative response of, you shouldn't have been doing that, you're a bad person for this, or other types of responses that can kind of further increase any negative thoughts or symptoms that might have already been there, or cause someone to start to view their situation in a different way than maybe they initially thought of it as well. So that's something that we want to be mindful of. We also know that what combat and what training and what those types of experiences look like has changed drastically from 50 years ago to now. What warfare looks like has changed. The risks, the types of injuries, all of that has changed. So, as someone who is caring about and wanting to support, or who is a military member, or veteran, that is something to be mindful of as well, is that this experience, depending on the timing, is very different from someone else's. And we want to recognize those factors in terms of how it might be contributing to healthier or less healthy outcomes. A few more veteran specific things that I want to mention before I move toward care, which I'm going to do because I realize I'm talking a little bit longer than I intended to, is, just other challenges. Homelessness has been significantly increasing for veterans. We know that legal issues as well have increased the likelihood of suicide ideation, which can be things like evictions, financial challenges, or child custody situations. We also know that risk is not proportional among all groups. So, individuals that are already in populations that have other risk factors, so individuals that are experiencing housing difficulties or homelessness, individuals of color, individuals from the LGBTQIA plus community, female veterans compared to male veterans have different types of risk factors that can come in that often we're seeing associate to an increased risk of negative mental health outcomes and of suicide in particular. One thing to highlight there with female veterans is the report of sexual harassment or sexual trauma. That would be its own presentation just to explore that topic, but it is something to consider that may have happened. But I do also want to highlight that it's not just female veterans. It can be male, non binary, any individuals that are in military service, obviously outside of it as well. But this particular military specific trauma, in terms of sexual crimes and sexual incidents, is a risk for everyone. It's just something that we're seeing more highly reported among female identifying veterans. So these are other areas to consider. I also have the 1 in 10 statistic of diagnosis for substance use disorders and the statistic that it's about 31% that experience PTSD. So I just wanted to give numbers again to the things that I've been highlighting and that I've been talking about so that you know that I'm not just saying it. These are things that unfortunately are being reported, documented, and seen on a broad scale. So let's talk about support. This is an important piece of it because I've mentioned the challenges, and along the way, I've kind of touched on a couple of things that can be helpful. One of the biggest things is just recognizing this context in the first place. We want to make sure that we understand to the best that we can what our loved ones, what ourselves, what our clients or patients, or however we interact with the military community, we want to understand what they're going through. A lot of these things I've touched on. There's also a difference between the types of care that can be received, military or civilian providers, the types of support that that means someone might have access to. So there are a lot of things to consider. We want to know what they've been through. We also want to know what their current situation is. Are they on leave or are they separated? Have they retired from service? Where are they in their journeys? Have they had physical injuries, exposure to death or injuries of ones that they care about? Things that they may have seen or observed. Have they been on base, off base, international, or within the United States? What does this look like? The more we can understand these things and the status of them, the better we can help. Again, whether as just somebody that you care about or as a provider, these are factors we want to understand. Something else that I want to note is when it comes to stigma and reporting, we know that mental health stigma is widespread among all populations, but when it comes specifically to military members, stigma can be increased. Again, there's efforts to decrease, but what we find is that there are real consequences to reporting mental health symptoms, reporting risk of suicide, reporting these things where someone's career trajectory can be affected, where someone may be separated from their unit, where someone may lose access to materials, to firearms, to whatever it might be that's a crucial part of their mission. So that can also be a barrier that comes with getting care and getting support and encouraging others to get care and get support. So I just wanted to kind of mention that the kind of stigma piece goes a little bit further when it comes to the potential ramifications for just trying to get help, even if you are willing to say that you need it. But we want to focus on fostering wellness. So one of the things that can be helpful is leaning into support systems. I know that sounds really very straightforward given that we've talked about the strains on support systems and all of that, but understanding who is in this person's network. If that's us, understanding what our relationship means to that person, what they might feel comfortable or uncomfortable sharing with different people. They're going to experience, okay, these are people that I feel safe talking to about what I've been through. These are people that I don't. These are people that I can talk to about how I'm feeling, but not what I've navigated. There are a lot of different kind of categories that our support systems may be in. And you probably recognize that in your own lives because there are people that you probably share more openly about things with than others or different types of things. So that comes through in terms of community and connection. And we want to help folks to figure out who their people are and who they reach out to and when and what that communication can look like. Other resources as well. So, supporting efforts toward getting mental health care or engagement with different groups or community outlets is important. So, if we can be aware of those and know what's around us, or if it's our loved ones or anything like that, helping them to find the information. It's usually given, but sometimes it's buried in other information. So, having the space to be able to find it together is important. Healthy coping and routines can be really helpful. Healthy coping, of course, obviously, that's helpful when we're able to take care of ourselves and we're able to do things that are a healthy way of expressing our emotions and managing our emotions. but routines as well, especially in transitions, trying to figure out the new normal and what things look like and fostering that. I mentioned that we talk to different people in different ways. So it's okay if this person or if we have specific boundaries we need to maintain or ways that we need to approach things differently. Helping someone to understand what that looks like for them can be helpful. And as somebody who cares about someone, just saying, it's okay if you don't feel safe to talk to me about those things. I'm not going to demand those things from you. I'm here to listen when you're ready to share. Having that safety in place so that someone doesn't feel pressured or pushed too soon, but knows that you're there for whatever might be helpful when that time comes. When it comes to transitions, as I mentioned, that's really difficult. So making sure there's adequate preparation and focusing on strengths and growths where possible also contribute to increased overall wellness. With suicide prevention specifically, if you're someone who's able to, you have training, comfort, or you just feel capable of asking the question, ask someone if they've had thoughts of ending their life. Be direct with it. It might be incredibly uncomfortable to do or very difficult with our loved ones, but asking is the best way that we're going to get an answer and know what kind of distress someone's in or what kind of support someone might need. So, if you don't feel comfortable with that, though, it's outside of your scope, it doesn't feel safe, find someone who can, or help that person hopefully to connect with someone who can. Because it isn't fully on you to have to do those things. And if you're able to, it can open doors to conversations. Any significant shifts in emotions or moods, drastic mood changes, erratic behaviors, those types of things can mean that there might be a crisis going on or sorry, or a significant shift in overall well-being. So that's something to pay attention to. Again, if you are not a provider, I'm not asking you to be someone's counselor, but knowing warning signs, knowing when someone's behaviors change significantly, when they're withdrawing from their friends, disconnecting from you, whatever that might be, can give you an idea of this person needs more support right now. You also want to consider their safety and yours. So, again, you may or may not be equipped to navigate these things. So, in that sense, emotional safety, but also physical safety. If there's a risk of physical harm, the idea isn't that you're increasing that risk to yourself or putting yourself in a dangerous situation. You want to be aware of what possible outcomes there can be. And if you can, help somebody to safety plan. If you know that suicide is a risk and they have access to firearms, getting a different lock cabinet that doesn't have a code that they know or doing something, putting them with somebody else for the time being can be really helpful ways to minimize that risk in the short term. You want to support any steps toward mental health care. And again, consider your role, consider your responsibilities. If you're not a mental health counselor, you don't have to be one. You want to be supportive to their efforts and, if you can, help them find resources. But it's okay to know your own limits as well. And it's important to do that so that you don't put yourself in a negative situation. This is my last slide of any content, so I'm almost done, I promise. I just wanted to say, acknowledge your own understanding, some strategies and tips. If you don't already know about the military cultural experiences or the specific branch someone's a part of, the ranking system, whatever it might be, learn about it, ask them about it, explore that to the extent that you're comfortable, because that can help you to understand and kind of bridge some of those communication gaps. If you do see something, say something, whether to them if you feel safe to do that or seeking support in different ways. We don't want to demand explanations and re traumatize people, but we do want to have open engagement to the extent that it's safe. We also want to avoid judgmental language. Things like, well, you would never think about something like that, right? Where it can put somebody kind of backed up a little bit of, oh, I can't open up about that. I shouldn't feel this way. It's not okay. We just want to be open, non judgmental, and there to create a safe space where we can. We want to think about if our own views affect the process in any way, kind of like I said about era of enlistment. If we have positive, negative, or in between perceptions, how does that influence the relationship you have with that person or their situation? And again, most importantly, be prepared to connect to resources. It doesn't mean you have to be a walking encyclopedia of different things, but have information or be able to help do a Google search or look through paperwork or whatever it is and help however you can. I mentioned traditional and alternative therapies. You see a picture of um, equine assisted and canine assisted approaches in these different cases because traditional talk therapy is not for everyone either. So there might be different things to consider for your loved one, for yourself, for your clients, for whoever you might be caring about and wanting to support. Right. So these are some different resources that I wanted to give to everyone. Obviously, 988, our suicide and crisis lifeline. There is a veteran and military specific line associated with that. So it's important to have that on hand, to know about that, to be able to share that with others if needed. And then these are also some different groups, some different chat lines, folks that are specifically working with military members, veterans, and families to try to improve the outcomes that individuals are experiencing. I also see in the chat, I saw some different things come up along the way. I know I had to keep talking at the time, but I see, passing along information. Miami Vet Center, Whispering Mains in Kendall offers apparently equine assisted therapy for veterans for free. That is wonderful to hear. Things that we can find like that are low and reduced cost, easy access for individuals are really helpful. And again, if it's these alternatives as well, sometimes they're more user friendly or more acceptable or feel safer to approach. So consider what someone might benefit from and might need, and then hopefully we can connect those dots a little bit. So my last slide is just a thank you. If there are any immediate questions, I know I talked longer than I meant to. I apologize for that. So we have a couple of minutes. If somebody wants to ask a question, you're more than welcome to. But I also put my email address here. So please don't hesitate to reach out to me if I can be of any help to you, if you have questions, comments, things, or just want to discuss supporting military communities and military mental health. I would love to have that type of conversation with you. I really appreciate everyone that's here. If you need to start signing off, please do. But again, if anyone has any immediate questions, please let me know. So, one thing I'm seeing is the question, is there a better way to say, I'm always here for you, buddy, for male to male support? And that's an interesting question because it depends on the person and the relationship you have. Sometimes just being there, just acknowledging, you know, even if you're not directly saying, I'm always here for you, but you're being present whenever someone starts to share, you're saying, I hear you, rather than, quietness or shying away from those conversations. Those nonverbal messages mean a lot too. I think that, I'm always here for you is a helpful phrase. So it is something that can be beneficial to use, but also, again, just all those other ways that we show someone. We can check in with them directly. Hey, how are you feeling? Doesn't have to be diving into the trenches every time, but the more that we show, I want to hear how you're doing and I care, the more likely we're going to get to have those conversations and hopefully be able to be supportive to our friends, individuals that are in need. So I'm not sure if that's a full answer to that question, but just those kinds of different ways for approaching I'm here and showing that. All right. So it doesn't look like we have any more questions. So again, thank you all so much for your time today. I've really enjoyed being able to talk with you about this topic. And again, please reach out if I can be of any type of support or help to you. Thank you again. Have a great day.